A 2026 case report in the Medical Research Archives Journal of the European Society of Medicine describes the persistence of COVID 19 mRNA vaccine components for over 3.5 years in one patient. Hi, I'm Haley, the PA, and I talk all things functional medicine and immunology. The 55-year-old man received 3 doses of the Pfizer BioNTech vaccine. He later developed progressive multi organ symptoms consistent with post COVID vaccine syndrome, including myocarditis, neuropathy, autonomic issues, Grover's disease, and more. After extensive testing across multiple independent laboratories, the researchers detected spike protein in plasma and circulating exosomes at 1,173 days after the final dose. Vaccine derived spike mRNA inside circulating exosomes at 1,284 days, and plasmid DNA fragments from the vaccine, including spike gene sequences and the SV40 enhancer, in skin tissue at 1,364 days, nearly 3.7 years later. Serial skin biopsies also showed ongoing spike protein deposition in endothelial cells, macrophages, and nerve fibers. The patient tested negative for nucleocapsid antibodies at multiple time points up to 1,433 days, excluding natural infection as the source. Additional multi-omic data suggested genomic instability and transcriptomic dysregulation more than 3.5 years post vaccination. The authors state this is the longest documented persistence of vaccine mRNA, plasmid DNA, and spike protein, and call for larger controlled studies to understand prevalence and clinical implications. This remains a single case report. With other peer reviewed data, the pattern is consistent with what I have been seeing in patients after vaccination. I have also seen many cases of CIRS, chronic inflammatory response syndrome, and MCAS, or mast cell activation syndrome, in that same post vaccination group. Mast cell activation after COVID vaccination has been well documented in the literature and linked directly to the injection, including life threatening histamine levels, Th2 cytokine surges, and markedly elevated levels of IL-6. My specialty is immunology and mast cell activation, so this is the pattern I look for, and thankfully, I have developed protocols to address this. There are also protocols based on the literature and Dr. McCullough's work aimed at helping the body break down residual spike protein that I offer patients at my clinic to detox. And fortunately, I have seen patients improve and spike protein levels decrease while on these protocols.